To another video on the Valera Endurance YouTube, and today I am super excited because I have the wonderful Claire Badenhorst with us. So I don't even know where to begin when it comes to introducing Claire. First of all, she's one of my very good friends from across the ditch, so let's not judge, but she's a Kiwi. No, she was an Aussie, but now she's a Kiwi. But I met Claire through research and we bonded over our passion for helping embrace females in sport and all things female physiology and all things, of course, strength training and endurance training. She did her PhD looking at carbohydrates and its influence on many different factors, including iron status. She's done a lot of research in female athletes and at the moment is undertaking some pretty groundbreaking research using menstrual blood for assessing health, for health assessments. But I could go on and on and on, but let's say a quick hello to Claire. So Claire, thank you so much for joining us.
Thanks, Kate. I will like to correct you. I do believe the first time we met was on a bicycle in a race as two female athletes. We bonded then, and I think that's been the story ever since. And then we discovered our research passion, but we were actually two female athletes mid-race having a good old bonding session.
I remember that because I'm pretty sure at that stage of the race we were going pretty similar pace and I
Yeah.
was like, I'm not drafting off you and you're not drafting off me, but we're literally sitting at the same stage. And then you took off like 5 minutes after that. That absolutely pumped me. But like for a few minutes I got to stick to you. So that was pretty exciting for me.
Yeah, that's pretty much how I remember our friendship starting. So I'm like somewhere on a bike.
Like that seems very us, absolutely. So we're going to be chatting about all things female physiology, and I thought we could do lots of these episodes, but today I wanted to start off with some of the very common questions that I know you get asked a lot, I get asked a lot, and I think that there's a lot of misinformation out there. So
Mm.
I think that having an expert like yourself in this field come in and clarify some things will be really, really helpful. So I wanted to start, Claire, and I know this is a super broad question for you to start with, but as a female athlete or as a coach who coaches any female athletes, what are some of the considerations that you think that these athletes or coaches need to keep in mind when it comes to coaching or training female athletes that differentiates from coaching male athletes?
This is such a good question, because I think what it really shows is when you actually ask this question and when you start talking to people, you actually realize the real difference in knowledge, that is even amongst academics, amongst coaches, amongst people that work in sporting organizations, around around like medical professionals and even athletes themselves. Like the difference in understanding and knowledge is so huge and so different. And so if you're going to be working with a female athlete and you want to start taking into consideration how her physiology is maybe impacting how she shows up at training, or how is she sleeping, how is she eating, or how is she feeling about herself on those days, which are all things that are going to impact training, then I think it's actually really important that both the coach and the athlete have a discussion or maybe have a look into what is their actual knowledge about what is the menstrual cycle, because that is a major, major gap. Most people I find have high school sex education type, like, ta-da, this is my menstrual cycle, this is what it looks like. I
Yeah.
actually think I have one friend that was like her biggest memory from like high school learning about the menstrual cycle was a male PE teacher sticking a tampon in a glass showing how it expands, because, that's very valuable knowledge to a girl.
Oh
Um,
no. And
but
I feel
honest,
like off-putting and a bit intimidating for that lady being like, is that what happens to me?
yeah, but also like the capacity of those things incredible. So you kind of got to look at it both ways, like gross, but also kind of like, or like, dude, what are you teaching me? Versus like, that's pretty cool, really absorbent. But side tangent. Sorry, everyone. I do that a lot. But yeah, I think it's actually like everyone kind of has this like textbook, what I call idea on this is the menstrual cycle without actually understanding it. So there are literally some females that have no idea why we call the luteal phase, or
Yes, when
what
you brought
is ovulation and
that,
what is the follicular phase. So if you don't even understand that,
yes.
how are you meant to then work as a coach or as a female yourself, recognizing your own body and physiology.
I hear
So,
that what
yeah.
you just said, like I see that in practice so much. So
Mm,
in Perth here, Australia greater than New Zealand. No, I'm kidding. But in Perth, like we have a women's health physio that works with us, pelvic health physio, and she goes through obviously like gives a really good
mm,
spiel about the menstrual cycle, and she'll often talk about it in say like a group class. We have postpartum classes or like women's strength classes, and she'll talk about things, and even the female athletes are like, well, hang on, what? What's this
mm.
phase? What's this luteal phase? What do you mean that can be shortened? Or I thought you either had your period or you didn't. I was either amenorrheic or I wasn't. I didn't know there were different phases that could be shortened or, anything like that. Or I didn't know I could push out my ovulation later on in the cycle and that was a sign of anything. There was just this, I see it so much of this mind blowing. So can you then, Claire, like take us through in a couple of minutes, a really good basic understanding of the menstrual cycle for female athletes or for coaches who aren't sure of it? Like, what's a really good starting base point for them to start to understand that?
Mm. Oh, absolutely. And then once you got the basics, you can always like delve deeper because this is again just the basic and there's so much to that what we need to unpack. So usually what I say to everyone is it starts on what we call day one. Day one is the first day of visible menstrual bleeding, okay? And that can last anywhere between 3 to 5 days for females. And that is often called either the menstrual phase or the early follicular phase, but it's a period of time in the female cycle that is characterized by the presence of menstrual bleeding. So she is having her period, her menstruation, or any of the other names that you wish to call it, of which there are many,
Many.
many, 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 many different
Fun
names we've
sign I've
given it.
heard.
And then pretty much after that, what happens is during that time, our what we call our reproductive axis from our brain to our ovaries is actually stimulating a growth of a follicle within the ovaries, which is the primary sex organ for females. And with that developing follicle, we get high, I guess, levels of estrogen. Our body starts producing that as that follicle is growing. So pretty much what you see is day one, a female starts menstruating, 3 to 5 days where there's visible menstrual bleeding, and then as that follicle develops throughout that phase, increasing levels of estrogen. And because that follicle is developing, that whole phase, including when you are experiencing a menstrual bleed, is known as the follicular phase. Then towards the end of that phase, your estrogen levels get really, really high, and they have to get super high because they've got to get your brain to release another hormone known as luteinizing hormone. And once your estrogen levels get high enough to cause your brain to release luteinizing hormone, high levels of luteinizing hormone cause ovulation, which is basically breaking of that follicle, release of the egg into the fallopian tubes. So typically ovulation occurs around day 14 of a cycle, but your follicular phase can vary quite a bit, and it's probably the phase that adjusts the most. So if you've got menstrual cycles that are sometimes a little bit longer or a little bit shorter, probably the phase that is moving a little bit and having a few extra days in and around it is that follicular phase. So you're not guaranteed to always ovulate on day 14. There is some variability with that because of how that follicular phase can change. But once you ovulate, the follicle that's left in the ovaries forms a little kind of gland that secretes hormones. That gland is known as your corpus luteum, and it secretes progesterone and estrogen. Now, because it's called the luteum, corpus luteum, the phase that starts from ovulation to pretty much the next menstrual cycle where you have your first day of bleeding again is known as your luteal phase. So scientists aren't very creative. So like luteal phase. So,
If you remember that, it makes sense.
yeah, it kind of makes sense. But yeah, during your luteal phase, you've got very high levels of progesterone, moderate levels of estrogen. They kind of peak around day 2024. And then as you get towards the end of the luteal phase, so in the last 3 to 5 days of that, that's where you start getting the breakdown and withdrawal of both of those hormones, which is usually when a female starts having some of those premenstrual symptoms. We also get the release of prostaglandins, which is another type of hormone that encourages uterine contraction. So that's usually when you get your uterus cramps before you have a menstrual bleed. But your luteal phase is a little bit more robust in how long it is compared to your follicular phase. So typically that lasts around 14 days. If it doesn't, then there's like a whole other area that you can kind of delve into. But like if a female is ovulating, generally the luteal phase is almost consistently 14 days because that is pretty much the lifespan of this temporary endocrine gland, this corpus luteum. So if you were to look at what is the menstrual cycle, first few days, early follicular phase menstruation, that's where visible menstrual bleeding, high levels of estrogen that then build from that for up until around day 14, but can be variable. Big peak in luteinizing hormone ovulation, then progesterone and estrogen both increase for 14 days, then decrease for about 3 to 5 days towards the end of the 14 days, leading to your next cycle. So
Okay.
that's pretty much it in basic terms. I always feel like I need like a,
I know. Well, I can see your hands as you're
I
going, so
know.
I'm picturing it in my head. From I know, I'll tell you what. I can get my editing skills on. I can pop an image up whilst
Oh,
this
that
is
would
going.
be lovely. I was
Well,
doing
I
a
mean,
talk
the skills out, but I think I can do that.
I
Yeah,
was
because
doing
I
a
can.
talk the other day and I was jumping around, like moving along like blocks. And I was like, because I don't have anything behind me. So I was like, if I start here and then I shuffle down here, that should make sense. But yeah.
That's a fantastic explanation, and I think that even for anyone just listening, I think that that's a really, really good foundation to begin to understand that. And without delving into that then too much, now this is I have so many questions. I'm so excited to ask you, but this is one I am sure that any listener wants to know the answer to because this is one that really irks me because. Like yourself, I'm sure there is so much misinformation about this. So, how do these phases affect females training and racing? So let's go through each of those phases and what the proposed, if any, influences on training, considerations that are needed for training, anything like that. Can you take us through those phases and what that means for the athletes?
Absolutely. But before I do, I think it's really worth saying that right now, if we actually look at the research in female performance, it's very, very minimal. A lot of the research has been focused around female health. So the research question for the last like 20, 30 years that a lot of academics in sport have been looking at is how does exercise affect the menstrual cycle? Now we're kind of having to almost change tact a little bit and look at how does the menstrual cycle affect exercise? So it's a very different question. So first thing I want to clarify, it's not that females have been completely absent from the research space. We've just been addressing a different question in the research, which we now know a large amount about. So now as we shift to performance, what we actually find is that the research in there that actually looks at how the menstrual cycle affects performance is probably of low quality and it doesn't have a huge amount of numbers. So our ability to say very decisively, this is what happens, is quite low. But on top of that, we're also dealing with the fact that for many years, and probably it's got something to do with cultural and social perceptions, a lot of females maybe feel it's a very taboo topic. They don't necessarily want to discuss when they have their period or anything like that. So if that is the perception, you might bring that kind of negative perception into that phase of your cycle, which could affect your performance. So generally what we sometimes see is almost two conflicting pieces of research, which is like, on one hand, when you have your period or you're menstruating, your hormonal profile, so your levels of estrogen and progesterone are very low. Like your body's broken them down, and because they're low, um, like you haven't got these hormones influencing how your body functions. So in that low hormone phase, there is a saying like that's when you usually get females in to do performance tests because there's no influence from the hormones in their body. It's going to be quite well standardized. They're likely going to produce good performance and everything like that. So there is that when you have your period, the low hormonal profile could mean you could perform quite well. But most females might experience some premenstrual symptoms that hang around for a few days, which could really affect their performance. And quite frankly, I know for myself, on like the first day of my period, if someone told me to go do a VO2 max test, I'd probably go tell them to jump off a cliff. Um, like, no, I don't feel like doing it. And that's going to be very individual. And then you've also got
Yeah, I
people
was
that
gonna say,
maybe feel,
do you find, sorry,
sorry?
Claire, do you find that more in athletes who have something, say, like endo or something related where symptoms may be worse around that time for them?
Exactly. It's going to be so unique and so different. So,
Yeah.
depending on the degree of symptoms that you have, that's really going to be the factor I think that affects performance in this phase. So, even though you have a very low hormone profile, you've got to consider the individual that's in front of you, like you do with any other training.
Mhm.
You've got to consider the fact that this person might have extreme cramps. They might feel bloated. They might just feel a bit like, you know what, it's a little bit inconvenient. Maybe they feel a little bit anxious and worried about having to do sport because maybe their menstrual bleed is quite heavy. It's quite uncomfortable. And you're literally sitting with sanitary items, either as almost like a diaper or up in your cervix. It's not comfortable running around with these things there. Like, I'm sorry, but it's not. And if you're heavy
Mhm.
and like, if it's a heavy bleed, you're feeling uncomfortable, of course, like, you're like, your mind's going to be preoccupied onto some other things. So,
Mhm.
yes, there's almost like two areas there where you could say you could perform well, or you could also
Yeah.
have not your greatest time ever.
Let's
Um,
say if you were a female athlete and you didn't experience any of those symptoms around that
mm,
time of your menstrual bleed, early on that early follicular phase, and say that you were bleeding, you had like a light to moderate kind of menstrual bleed, and you experienced none of those symptoms. Again, this is of completely limited research and it does
mm.
still depend on the individuals. But would you say, well, that could be a good time for performance for that athlete?
Yeah, exactly. If you feel good, pretty much
Hmm.
like anything, like if you feel good,
Hmm.
that should not be a reason to stop you from performing well. So if you're a person that doesn't have any symptoms and it comes and it's a bit like a non-event, then
Yeah.
of course, like oh, it's another week, it's another Monday kind of thing. Like you could actually perform quite well, and especially if maybe like those few days before your period generally, so that late luteal phase, so I am jumping into a different section here, but if we take a step back before menstruation, those
Mhm.
3 to 5 days tend to be very symptom heavy. So
Mhm.
generally, that's often where someone might start presenting as quite tired, not feeling like they're recovering as much. They might have some cramps, there could be some bloating. And again, you put all of that together, and again, that could have very different impacts on the individual. I know, again, for myself, I get quite tired and fatigued, and it's suddenly
Mhm.
like, oh, is something wrong? And
Mhm.
then within a few days, my period starts. I'm like, ah, fatigue's gone.
Yeah,
But for
yeah,
me, I actually have to moderate that recovery a little bit more in that phase. Otherwise, I always used to get to that point and be like, what's going on? Like, why am I so tired?
yeah.
Um, but
That
again, very
yes, with
individual.
like endo, I'm the same. Like
Mm,
to me, it's just so endometriosis. That it's those few days before it's bloating is just
mm,
that's sometimes more painful than anything else. And then yeah, over that side of that menstrual cycle, it's just like nope. And yeah, again, yeah, or research might show or physiology might suggest that around that time with the hormone profile, you could perform well, and that's great if, like you said, you have a non-event. But if you you do experience some symptoms,
mm.
then it's yeah, totally individualized. Okay.
Yeah. And that's where I think having some knowledge or just having some awareness around maybe when that's occurring can
Mhm.
actually be very helpful.
Yeah.
Because then if you go past that, there is that like you start going into the end bit of that follicular phase where we have high estrogen levels. So
Mhm.
there's been a lot of research looking at what estrogen does for females. Like it's an incredible hormone for bone health. It does like shift our metabolism a little bit. There is rapid uptake of carbohydrates from our blood. It does allow us to utilize fat as a fuel a bit more efficiently. It's really good for your cardiovascular health. And again, here I'm in almost like, yes, the physiology says estrogen maybe would support females to perform quite well, but
Mhm.
there's also that huge psychological component of, yes, period's done for another month. I feel good kind of
Time to
thing.
party.
Yeah, exactly. You're like, I feel good, it's done,
Yes.
finished for
Yes.
another month.
Oh.
Yeah, and so it's like, do you perform well in that those few days afterwards, where again, um, it could be hormone related. It could also just be the fact that you've finished your period and it's done for another month, and that
Happy day.
load of worry, anxiety, whatever it is, oh my God, that discomfort's past. Now I can actually perform quite well. I don't have to worry about that.
Mhm.
Um, and I honestly think there is a little bit of both that goes into that. But also keeping in mind that although the research says that this hormone can influence our metabolism, as soon as someone eats or as soon as a female eats, she's of course putting carbohydrates into her body. Your body's going to use the carbohydrates which are in your blood system, which have been absorbed from the food that you eat. So generally, what you actually see with the hormone changing your metabolism is very much in and around a very fasted state, which might occur in a research setting. But if you're
Mhm.
practicing good training and fueling practices, you should very rarely be going into any endurance sport in a
Yeah.
very fasted state.
Yeah.
So,
Makes
um,
sense.
and then when you get to ovulation, often there is like, this is when you feel really strong and powerful because there's like a small blip in testosterone for the female then. Um, but again, hugely dependent. Like I have some
Mhm.
females that feel very strong, very like, yeah, they're still on that vibe from like post-period finish.
Mhm.
But then as well, I also know a lot of females that maybe have ovulation symptoms. So some feel cramps, some feel
That is
discomfort.
that is me. I don't know if
Yeah.
it's my endo or if it's just bad luck, but I know there's that research behind it being like this should be your time. And for me, I'm
Mm,
like, this is my time. Like this is
yeah.
my cripple over in pain. I could tell you the pinpoint time of when I am ovulating, and it is horrendous. And I've
Mm,
always been like that. And I know that around that time, I'm like, there will be no running today. A swim or a
mm,
bike, like that is kind of
mm,
okay. But the thought of running around that time for me is just too much. And it's so unlucky because I do think that females like me are experiencing those are definitely a little bit more on the minority. I know that a lot more do
mm,
feel a lot more, oh, let's go. Like, Free race day falls on around this time. I find it horrendous. Like, for me, this
mm.
whole cycle, that's the worst. And that, I think, shows what you're talking about, where it's just this complete individualized, like, you
Mm.
have to see what works for you. But yes, sorry, carry on there, Claire. I'm
No,
talking.
I think that's a great discussion because, yeah, a lot of people don't realize that although that's the narrative that people want to hear,
Mm,
there are females that are like, they will tell you exactly what day they're ovulating because they're like,
mhm.
it is so uncomfortable. And I'm
Everyone
like,
knows that.
and that's just the way your body responds. That is completely fine. It's completely normal. The thing is, you know, and you have some awareness around that, which is the amazing thing.
Yeah.
Um, and then when you get to that luteal phase, so now your main hormone is actually progesterone. And progesterone is really interesting. It's like it couples with estrogen very well, but it often has the opposite action to estrogen. Um, and so there has been research that says it breaks down carbohydrates a bit more readily. It's what we call a catabolic hormone, so it actually breaks down protein in tissues a little bit. And that's pretty much a very interesting role and linked almost with that, how it prepares that uterus lining. It's converting it from its growth phase to a preparation phase. Um, and it also has the ability to bind with some of our, I guess, neurons in our brain. And generally, the mood that sets in with very high progesterone tends to be quite calming, quite sleepy, quite meh. So if you're ever in that, like, maybe like a week before your period, and you're just like, oh, I'm a little bit tired, like, yeah, all that mellow kind of feeling.
That was me both times. I was like,
Yeah,
I like progesterone, except for when
progesterone
I got
can be
things
a really
to do.
good thing.
Yeah, not when I got things to do though. Sometimes I'm like, no, I can't be too chilled out right now.
So it's great. And it's so yeah, like during that time, often the thing that gets said is that like you need more recovery, or you need to eat more carbohydrates. And it's like, yes, but again, the metabolism side of things is very much as soon as you eat, you use what's in your body. And that's what a lot of that kind of research has shown is a fed female uses what's in her bloodstream, doesn't really, the hormones effect, it's a little bit reduced.
Mhm.
Um, but in terms of like recovery and stuff like that, of course, it's always worth then considering how you are recovering in that phase. And if you do feel sluggish, then looking at that dietary intake, looking at your training schedule, do you need an extra 30 seconds? Do you maybe need to increase your protein intake in and around that time in order for it to be beneficial? Looking at your sleep patterns could actually also be incredibly interesting to do. And then, of course, as I said, you hit that late luteal phase where your hormones actually start breaking down and withdrawing, and that's what is that signal for you to start your next cycle. But
Mhm.
with that withdrawal of both estrogen and progesterone, effectively what's happening is you're always having like, yeah, withdrawal symptoms. So you go from your mellow state where progesterone's kept you nice and chilled out, and all of a sudden that's going away. And so sometimes you're a bit irrational, you want to
Mhm.
cry for no apparent reason. I mean, I walked into the gym the other day and started crying for no reason. And everyone's like, what's wrong? And I was like, hormones.
It's day 26.
Exactly. I was like, oh my God. But yeah,
My
and
disappearing. I'm not
it's
happy
okay,
about it.
Kim. We'll just go squat.
Come on, nothing a bit of squatting can't fix. Love
Exactly. But
it.
another thing that's always really interesting is progesterone is a very like it's a very metabolically active hormone. So when we actually have high levels of progesterone in our bodies, after ovulation, what you actually see is a female's body temperature increases. So it increases about like zero point 0.2 to zero point 0.3 of a degree. And with that elevation in body temperature, some of the research will show changes in ventilation, changes in heart rate, changes in how you regulate body temperature. If you are in a very almost like fixed kind of exercise trial research study kind of thing. But also that there might be that increase in appetite. And generally, some of the research has shown that in that luteal phase, females might eat around 200 to 300 more calories because of the effect of this hormone. So if you are feeling hungry after ovulation, it could be a result of progesterone. Um,
And
but
should we
with
just listen to that?
absolutely, of course, your
Good.
body
Because this is
needs
what I
it.
do.
Yes, good. Um,
Our
but
body
I
tells
think
us, right? Don't ignore it.
exactly, 100% agree. And I think a really interesting thing is where a lot of research has shown that like it affects how females regulate body temperature because now body temperature is a lot
Mm.
higher.
Yeah.
Um, it's quite interesting because a lot of this research was done where they actually um, it's almost like a very fixed setting. So
Mhm.
we weren't allowed to use any of the behavioral mechanisms that we have available to us. So if you're exercising in a very hot environment, um, generally what most people do might like take a shirt off or
Yeah.
slow down their power output or something like that. And when the research actually then looked at how females regulate body temperature at different body temp, like in these different phases with different like basal body temperatures or baseline body temperatures, they actually found that when you allowed well-trained females or training females to actually just like, you got to do it in this environment, you're doing it on this day because this is your luteal phase or this is your follicular phase,
Yeah.
they actually found that they regulated their body temperature through behavior very
Yeah.
well. Because, of
Yeah.
course, we've got years of doing it. So
Yeah.
it just
Yes.
happens. So, yeah.
Yeah. So you just know, right? Again, you're just listening to your body. You're going, I'm a little hotter than normal today. I'm
Yeah.
going to take my top off running my sports bra, or
Mm,
I'm going to maybe just drop my power output a little bit, or you know what? On my wind train, I'm going to turn an extra fan on. Like,
mm.
I might get up earlier and run.
Yeah, just on the sports bra thing, because one of the symptoms that I do know happens like premenstrual or sometimes menstrual is breast sensitivity. And honestly, um, like if I could describe it to any guy, it's like imagine someone gave you a nipple cripple and then told you to run. Like honestly, that's the only way I can describe it. It's not breast sensitivity in a nice, lovely way. It's like nipple cripple, then I'm gonna clamp some like clothesline things on it and tell you to go for a run.
Well,
Like,
no, and it's like you're saying, it's like sometimes things like that in itself, like
mm,
the symptoms like that is enough to impact performance rather than anything that the actual hormones do. It's like those
exactly.
symptoms that you get from it. Like if you're experiencing that and you want to go for a run, or you're bending over in time trial position, someone feels like you're giving you a nipple cribble. No one, that's not going to be fun. Like, or your
No.
RPE may go up, right? You can probably still hold your predicted power output or something, but all of a sudden you're like, that was a lot more uncomfortable than it
More
should have.
than normal.
Like it wasn't my legs, but I'm telling you now, my RPE was higher. So I've got a couple of like questions that are burning for me to ask
Go.
you. Okay, so I'm going to start with this one before because I think the other one's going to go a little more off topic. So when we see, and there was a big governing body that did an infographic, and I feel like this is because researchers and coaches and all of these bodies are trying to now go, we're all about females participating in sport, woo, let's go. So they're almost trying to go on the other end of the pendulum and
Mm,
put all this information out based off research that isn't there yet, like you said,
mm,
and it really comes down to being individual and just listening to your athlete. But they're trying to sort of group all of this information together and apply it to every single female. So I see things like follicular phase is the time to, go for it, crush it, whatever. And then they virtually give you, like you said, that 14 days of the luteal phase. That's pretty stuck. Like it's generally around that 14 days. And then they say that's 2 weeks of yoga, rest, recovery, zen. And I'm like, what the dickens? If I'm going to go and perform, I've got a marathon coming up and I want to qualify for London. If I am training 50% of the time and then the other 50% of the time I'm just practicing meditation, I can tell you now, I'm not going to hit my qualifying times. But this is the information that's getting out there, right? Would you
mm.
say to female athletes and coaches just to be skeptical and ignore that kind of general information, or is there something more to it?
I think as like our discussion was saying beforehand, it really comes down to the individual. And I think realistically, you can have all these coaching frameworks. Like there's always been different coaching frameworks. Like you had the like 3-on-1 periodized training framework, and then you had the like 2-in-1, and like everyone's got a different type of coaching framework that
Mhm.
works for them. But I think where the discussion of the menstrual cycle comes in is not so much to train to the cycle. It's to see how you can enhance those one percenters, that recovery, the support you give the athlete outside of the training. So you can have your structured training program potentially as you've always done it, because you know what? That's really good. It gets us that we train all the energy systems and things like that. But if I want 1% more from that female I'm working with, what am I doing to help her with her support network, her recovery, her nutrition, her knowledge, and her awareness around herself? Because an athlete that is aware of themselves, that is healthy in themselves, is the one that's going to perform the best. Health first, performance second. And that's where this discussion comes in. So I think, yes, there is infographics, but why on earth have we suddenly gone from everyone should be unique, we'll train them, like we'll give them a rough guideline, we'll structure the training specific to them, and then be like, yeah, cookie cutter approach, this
Yeah.
works. And it's like, no, But I think if you think about how we can use this information,
Yeah. I
it's
I
the
love what you
1%.
just said. Like that, just like, yes, yes, perfect. Nailed. I feel like we could just pop that in a clip and be like, anyone, if you're gonna listen to this, this is your big take. Signed off, Dr. Claire Badenhorst. I love it.
Thank you.
Okay, now you've sparked though another question before my other question. Now
Okay.
I've forgotten what my first question was. So, with monitoring your individual, like I was saying, it's then, okay, how do I, I've got my normal training program. I'm just going to consider the menstrual cycle ways that I can help her recover and look after herself and, make a modification as needed.
Mm.
Would you say to those athletes, is it easiest for them just to monitor, like just pop comments on training peaks or keep a journal, or what do you recommend? Like, do you think that's something they should do, every day of the cycle for 6 months and then see if they can identify a trend, or like what's your kind of go-to enable athletes to get a better understanding of how they feel at different
Mm.
stages? Sorry, that's a huge question.
No, it's not. And I think this is a really interesting point, because yes, there's a lot of information out there now that's like, yeah, we want to be for the females. Let's talk about menstruation. Let's break down the taboo and everything like that. And I'm like, inner feminist is, super stoked by it. But at the same time, I think there needs to be a very considerate discussion with whoever you're working with on maybe their cultural sensitivities around the topic, but also
Yeah.
considering that this is very personal health information as well for the individual. So there are some ethical considerations
Yeah.
around what data you're collecting and how you're using it as well. And a
Yeah.
female, especially maybe in a team environment that is providing this very personal information, wants to know that ethically you're using it for the right reasons and you're not going to discriminate against them by being like, well, you're on your period, you don't make the lineup today, do you? And
Yeah.
like that would be very ethically incorrect,
Mm.
and very wrong
But
to
female
that
athletes
individual.
still have this fear though, don't they? Like it's still
Exactly.
a real fear, isn't it? It's like they go, oh, and like you said, there's so many like cultural considerations and just personal considerations. Some
Mm,
people just don't feel confident having these conversations or comfortable having them. They never have, they never want to. Some people just don't want to, and it's like their own information. So what
exactly.
what would you kind of say in that instance for someone who doesn't maybe feel comfortable exposing that information to their coaches? Like, would you say, they could just jot it down in terms of just general on a fatigue scale or something like
Mm.
that?
Well,
Is
you
that a
see, I think this is where, like, using some of those metrics that we have, maybe it's RPE,
yeah,
heart rate, how you're feeling on the day, if there are any symptoms that you are experiencing. But I also think it's a very important discussion maybe to have as an athlete and coach on, listen, I want to do this. I want to consider it not so much for your training, but for like your recovery and your support of you as an athlete. To what level of information, or what level of information are you happy to give me?
yeah,
And I think that is a discussion coaches need to have with their athletes. Out of this, I'm not going to tell you to do ovulation tests or feed me all of this information. Like, you can if you want, but as well, what level do you feel comfortable giving me?
yeah,
And if it's, I've started my period today and that's it, or I've experienced a symptom, or if it's literally just like, I've started my period today, I've started my period today, I've started my period today, and you just get length of the cycle. As
mhm,
long as the person giving that to you is comfortable with giving that information, you can then look at other things, maybe like fatigue, how they're
yeah,
responding to that training,
yeah,
something like that, and you might notice those trends. But
yeah,
I think we've kind of come out with very much like a very forceful, almost like this is now what we need to do. And I'm like, this really still doesn't actually,
no,
um, like it kind of has that very much a bit of almost like the patriarchal kind of tone to it still of like,
yeah.
okay, we've decided we're going to support you, so we're going to support you kind of thing. And
Let
I'm
us
like,
help you. And it's like, oh,
yeah,
I don't really want your help. Like, it's okay. And I think, too, maybe also just making your athletes aware that door is open. If they ever
yeah,
change their mind, they can say it. But yes, I totally agree with that. I think then sometimes then coaches can be too full on and they want to know
mm,
too much. And it's like, no, like, just you'll see from my numbers. If I'm hitting my numbers, you'll see if I see you at training, if I get to the track, do I look like shit? Maybe it's something to do with my cycle. Maybe not. Maybe
yeah,
also, and that's it too. I think that a lot of coaches or athletes, female athletes, athletes are so quick to put it on, oh, I'm at this stage of my cycle. But then, I think about myself, I'm like, I've got 2 kids, just under 2, and I'm trying to run a business and do all these things. I'm like, I don't think that's anything to do with my cycle. Like, I think I'm just tired. So it's all
Exactly.
the way that you go about considering
Mm,
different aspects from the cycle is really not too dissimilar to what you should be doing anyway. Like, you should be prioritizing your sleep. You should be eating when you are hungry. You should be
mm.
listening to your body. Like, all of these things really, and this is something that I love about research, is because I often find you come out of it and go, well, duh, like, yeah, that's what we should be doing, right? Like, so sometimes we need it on paper to be like, guys, this is what we should be doing. This is what we've been doing all along. But now we know we should be doing it. So everyone that was already doing it, keep doing it. Keep your
Yeah.
graphics to yourself, and here's the basics. Really. Now I'm going to ask my other question before I forget. So we've gone through this cycle, but I think you know what's going to come now. What if you're on the IUD, or what if you got your Mirena, or you're on oral contraceptive pill, and you are, say, progesterone only, or you can't monitor your menstrual cycle, if you have the Mirena in or anything like that, where you go, I don't know what day I am on. I have no idea. My symptoms all get a little bit confusing. I'm trying to monitor. I have no idea. What are there any differences then, or does it really come back to the start again when we go, well, no, just listen to yourself?
Mm. Well, it's also going to be completely different depending on what type of hormonal contraception that you're on. And this is
Yes.
another discussion that I think is very interesting, because all of a sudden we're like, periods! Everyone should have one. And poor hormonal contraception's now got such a bad rep.
Yeah,
Um,
it
yeah,
does. Kind of, I have a lot of people go, no, you shouldn't be on that. It's so bad for you, or this or this. I'm like, oh.
nah, like there is a time and a place for contraception. And now
Mhm.
what I say is that at the end of the day, as well, if your female is on hormonal contraception, remember it's been her choice to
Yeah.
go on to that. And that is a choice you've got to respect as a coach.
Mhm.
So you can find out what type of hormonal contraception it is. It is not your role as a coach, a non medical professional, to tell that athlete you are on the wrong form of hormonal contraception. That is a medical professional's, and don't blur that line.
Mhm.
So it is about understanding, potentially again, like as you do a medical check when you're working with an athlete, are you fit to exercise? Are you on hormonal contraception? Yes, no, I'm on this. Cool. Okay. I need to go away as a coach, find out what that hormone profile is and what is how that could affect the athlete. It could affect them brilliantly because,
Mm.
again, psychologically, there might be less anxiety in and around that because they are able to know when they're going to experience that withdrawal bleed. Or with some of the more long term contraception, so your IUD or your implant, like they might not have a period. That
Mhm.
doesn't mean they're amenorrheic off the bat. It doesn't mean that there's anything wrong. That is just the form of hormonal contraception they've chosen to use. Respect it and understand that then as a coach, it just comes down to, again, when do they feel good? When do they feel bad? What are the other things that could be impacting them? We really need to be really careful of the fact that we shouldn't be slamming someone for their choice to have contraception. And in some cases, hormonal contraception, like the hormonal IUD or the Mirena, is a godsend to people with polycystic ovary,
Very.
endometriosis,
Yeah.
extreme dysmenorrhea or pain around their
Mhm.
menstrual cycle.
Mhm.
That hormonal contraception, absolute game changer.
Mm. And
So,
that's speaking, like, just for an example, I know a
mm,
lot of people are really against, like, the Marina. I've had it since having the boys to look after my endo, because after I had them, unfortunately, my endo just came straight back, and I was like, oh,
mm,
and I would not really be able to run. And it was more than that. It was like, I need to be myself to look after the boys, but
mm,
also I really want to go for a run every day for my mental health and my physical health. And so I had that put in. It was a bit rocky at the start, and I was like, oh my goodness. And it is a godsend now. And I can
mm,
tell you now that for myself individually, I would
mm.
not have to tell my coach, who is my husband. I was self-coached till a couple of days ago. But because I don't have days where I feel really good and really bad, I just feel good all the time. Like, and it
Mm,
is my godsend. I don't have these symptoms anymore. Like, it's fantastic. And that, in comparison to being on, like, not having that, it's just chalk
mm,
and cheese. But I know that the opposite is true as well, and that
mm.
comes down to, if we have these conversations with people, just going, oh, I'm really glad you found something that works for you. That's great. Zup, fabulous.
Exactly. So
Mm.
I don't think it's one where it's like, I think again, having education and awareness around what hormonal contraceptive does, the thing that like, no, you're not regular if you're on the oral contraceptive pill. The only reason you're regular is because you take 21 pills. The pill's regular, you might not be if you come
Right.
off it.
Mhm.
The fact that you're not ovulating if you're on the pill, it's the nature of these hormonal contraceptions is to
Mhm.
stop ovulation, although the hormonal IUD does allow for ovulation to occur later on in its life, or the lifespan while you've got it in. Um, and as well that you don't have a menstrual bleed, you're having a withdrawal bleed because you're
Mhm.
having a withdrawal of hormones, but your big fluctuations in hormone levels that you normally see in that beautiful textbook menstrual cycle that we talked about, that
Mhm.
is flatlined.
Yeah.
And that is the role of hormonal contraception. How that affects females long term, that is a question that we're still potentially going to have to look at and dive into. We have had very different generations of pills. There's so many different types now, and every single one's concentration is going to vary depending on what brand you use, what concentration of hormones they use. And so it's going to be you if you're doing these studies long term, you kind of have to like one group, put them on one thing for a long period of time. It's yeah, it can get quite interesting there. So at the end of the day, I think we actually just need to take a step back and actually, as we said earlier, like, what is the reason we're actually asking this information? It should not be to train to this. It
Mhm.
should be to make the person a better athlete through
Optimize.
providing them with that support,
Yeah.
um, enhancing their health and well-being, maybe providing them with a bit of education, seeing how it affects them as an individual. And like you would if something's wrong with nutrition, you refer them on to a nutritionist. You don't give them nutrition information yourself. Something's wrong, or like both of you maybe feel, or she feels comfortable telling you that, send her to a medical professional. Because at the end of the day, it is about using very personal medical information to make this person a better athlete.
Yeah.
Um, and I think that's pretty much what right now the best way to kind of consider this
Yeah.
physiology of a female.
So we'll kind of wrap it up now a little bit, Claire. So what's your big take home? If you can just summarize it, this is, sorry, giving you a hard task here. Summarize everything that we just talked about in the last 47 minutes into just a couple of minutes. So any female athlete or coach listening, scroll to this bit and go, I get it. What would you say?
Periods are cool. No, I'm sorry. I'll go into that a bit more
And then not. No,
and sign off. Um,
it's
no,
very your opinion. No.
I think one of the key things I want people to take away is that we need to consider that when you're working with an athlete, you're working with a person, regardless of whether they're male, female, however they identify as well. And at the end of the day, it's health first, performance second, and a healthy athlete is going to perform well. So the menstrual cycle, how you treat it, how you approach that information is not about sometimes how to maximize performance and training. It's about how do you make that athlete healthy within the training that you're prescribing to them and using that information to really help inform how you support that individual. Because everyone's going to be unique, and we know that. I mean, men are quite unique and they don't have a period. So, if we can do that, I'm sure we can figure out how to support a female with slightly different physiology. So if I had to summarize everything, it's you can collect that, but again, remember you're treating an individual and you've got to put that individual first. And if you've got to go with the information they feel comfortable giving to you as well. So yeah, I think if we kind of wrap it up in that, it's just remember it's you are just dealing with a person. Um, yeah.
Beautifully summarized, Claire. Well, thank you again so much. I know so many coaches and athletes are going to find this so helpful. You've explained everything just incredibly. And I'm looking forward to many more of these conversations. I think that I might pop it out there. And in fact, if anyone has any questions, pop them in the comments below. And Claire and I can definitely chat about them on the next one.
Yeah.
Q&As, I find it always great because you find out what's going on in people's heads and the misinformation out there or things that they've just been burning to know and they don't know where to go to for those answers. So I think that would be fantastic.
Yeah.
And yes, we will chat to you again very soon. And thank you again, Claire.
You're so welcome. Thank you for having me on. It's been so good. And I can't wait to come back on again.
Awesome. Thanks, Claire. Bye.
Bye.